And so I'm delighted to invite Dr. FARAH M SHROFF. FARAH is public health researcher and educator with the Department of Family Practice and School of Population and Public Health. Her research focuses on integrative health practices and taking action on the social determinants of health, and she has taught self-care practices around the world. FARAH is the founder and leader of Maternal and Infant Health Canada. And today, FARAH will discuss what can integrative health systems offer us during the COVID-19 pandemic? And thank you, FARAH. I see you've taken over the screen and you're ready to go. That's wonderful.
It's wonderful to be here, everybody. And I hope that all of you are doing as well as possible. These are times of really great change. And I really hope that all of you are riding these waves of change. And we'll be talking a little bit about integrative systems of medicine in this brief overview today. And my real hope is that at the end of it, all of you do have a sense of what the literature and what the evidence says for just trying to feel a little bit more well during these times of change. So I'd like to acknowledge that we are, at least I am, on the land of the Coast Salish nations. This is an image of UBC and one of the beautiful pieces of art that we have on campus. And certainly the Indigenous peoples of Turtle Island have a lot to offer the conversation we're about to have. It's very, very relevant. The things that I'll be talking about are very resonant with a large number of Indigenous systems of health. I also have no declarations of conflict of interest to share. There are no commercial interests at all in this presentation. We'll be talking about integrative health, an overview. We'll talk a little bit about COVID-19. We'll talk about Ayurvedic medicine, yoga, a little bit about laughter, a little bit about salim-yoku or shinrin-yoku, and then we'll have some interaction with each other. So I'm just curious about who's here. So we've got a poll going, and I'd like to know who you are. Are you a health or medical researcher? Are you a clinician, a doctor, a nurse, a physiotherapist, an OT, any kind of a clinician, a doctor of traditional Chinese medicine, a naturopathic physician, any kind of a clinician at all? Are you a student? Are you related to university? Are you an interested citizen? All of those things. I'm curious to know who you are. And once you've done your poll, my friends, if you don't mind, just you can move your poll by pressing the X at the top of the bar, or by minimizing it somehow. Because while our tech people are going on with the poll, we'll see the results of that in a moment, just so that we give people a little bit of time to answer that. Normally when I'm in person, I always like to know who's in front of me, and so this is my way of trying to find out who's here today. So while we're waiting for that, I'll just reflect on the topic at hand today. The question of health really, it's a really big question when we ask people what it is that health means to them. And in the end, I've done hundreds of these kinds of workshops asking citizens and healthcare providers, what is it that health really means to you? And in the end, about 90% of what people say, they say things like, health to me means balance or energy, vitality, being curious. There's so many things that end up meaning health to people. And they correlate about 90% with the same definition as happiness. So health and happiness are almost always really very synonymous. And there's pretty much nobody in the world who doesn't want good health or happiness. And there's also a movement toward making health a human right. And that leads me to say that today we're not going to be talking about structural approaches or public health approaches to health. Those things which are related to income, social equity, those things which address racism, sexism, poverty. We know that there are many, many pillars and roots of health, rooted in education, housing, social support, gender equality, all of those things. And in our very short time together, we will not have time to address those. I do that kind of work, and that's a huge part of who I am in the world as a public health educator and researcher, but we won't be touching on those topics now. So perhaps, Dan, you could just show the results of the poll. So it seems like the vast majority of those of you who are here now are interested citizens, and a smaller portion are clinicians and researchers and others. So thank you so much for that. I've just wanted to do one more now, and just ask in terms of your own experience, whether it's personal or professional, with this area that I'm calling integrative health practices. Other people, or myself included, sometimes use the term complementary or alternative medicine. Sometimes we use the term holistic health practices. There's quite a lot of language in this field. So if you can just fill that in and give me a sense of who's here as well. And then once you've done that, we'll do the same thing and just exit at the top. But it looks like, again, we've got a majority of people who have a little experience as a patient or say as a student, and then some who have some moderate experience. So that's lovely. Thank you so much. Great. So wonderful. I think we've got it. Yeah, we've got, so most of you are in the little experience category. That's great to know. Super helpful. Thank you. Awesome. Okay, so now, given what we know about who's here, I wanted to just tell you that in my own research, I try to find things to research that are really going to make people healthier. That's always my biggest aim. So how are we going to create better health, better care for better value? So the question that I ask about holistic practices are, do they meet the triple aim? And I can tell you that I wouldn't be here doing this presentation today if I didn't believe that they do meet the triple aim, because certainly those are all three really important facets of my work. So what is integrative healthcare? It's defined in many different ways, but I'm just going to read you just a few things that will put us all on the same page about what these practices entail. So they're about the partnership between the patient and their practitioner in the healing process. And they're also inclusive of other factors related to health, wellness, and disease, including the mind, spirit, and the community. All of those things have impacts on the body. Number three, an appropriate use of conventional and alternative methods to facilitate the body's innate healing response. Number four, effective interventions that are natural and less invasive should be used whenever possible. So kind of an appropriate technology as well. Number five, integrative medicine neither rejects conventional medicine nor accepts alternative therapies uncritically. Number six, good medicine is based in good science. It is inquiry driven and open to new paradigms. Number seven, alongside the concept of treatment, the broader concepts of health promotion and prevention of illness are paramount. And that is actually the part of the health world that I inhabit, health promotion and disease prevention. And number eight, practitioners of integrative medicine should exemplify its principles and commit themselves to self-exploration and self-development. So that's also very important. So there are many different conceptualizations of that, and they manifest in practitioner-led practices. So I define these as practitioner-led, self-led, and products. So the practitioner-led are grouped in very loosely African traditional medicine, Ayurveda, which is the only one of these that we're going to talk about today, traditional Chinese medicine, shamanic systems of medicine, homeopathy, naturopathy. There are so many more. And there are over 300 different kinds of treatments within all of these. So that's just a very broad conceptualization of different systems. And here we are, I believe most of us are in Canada, but I work in global health, and I think it's really important to take a global perspective on this, because around the world, most people, and if you roll up the data, it's about 75% of the world's people have at least some aspect of their healthcare which is integrative. Certainly in South Asia, it's around 75 to 80. Again, it depends very much regionally, according to education, according to a lot of other factors. The African continent as a whole, again, mainly in the rural areas, about 80%. Latin America, Cuba, the Middle East. North America, the studies show that at least 75% of North Americans have tried systems of integrative care at least once in their life. And I did a study comparing Canada, the United States, and Mexico, and my own study found that Mexico within North America had the greatest uptake of integrative health. Europe also has a very, very old system of herbalism and many other systems of care. And I would say that North America is probably the laggard in this regard, except for indigenous systems of medicine, which are definitely having a comeback. And I'm so happy to say that. I do quite a bit of work with indigenous healers here in British Columbia. So the majority of the world's people access holistic health practices, and the self-led practices are many, and some of them include yoga, which we will be talking about today, Tai Chi, Qigong, meditation, and then there are the products, things like supplements and herbal products and a whole variety, a whole cornucopia of products, which we will not have time to talk about today. So let's talk a little bit about where we are at in terms of this moment in the year 2020 with COVID-19. As we all know, because it is in the news every hour and every moment of every hour, it has far-reaching global impacts. And of note for our topic today, its far-reaching impacts are really on mental and physical health, but certainly on the economy and politics and on social norms. This is a game changer virus, and it is making a huge difference to all of us. So of all the different things that we could talk about, what I've chosen to talk about in terms of the COVID-19 crisis is stress, and the reality that there is widespread uncertainty and fear. These things are manifested financially, emotionally, mentally, socially. They're related to the fact, partially, that we're staying at home a lot, that some people are developing a kind of a cabin fever, and that all our functions are at home now. Our homes have now become our offices. Our homes are daycare centers. Our homes are schools. Our homes are places where people are getting sick. Our homes are places where people are recovering. We are on the screen all the time. And I'm sure many of you know that there is a new diagnostic code called screen addiction. So all of these things are contributing to stress and contributing to the early data that we're seeing on anxiety and how anxiety is really going up. One recent American study showed that in states where there are really heavy lockdowns, that women's anxiety has gone up by 66% over the time of the lockdown. So I thought that was very significant, and that's why I've chosen to focus the rest of our time today on looking at stress and really what integrative systems of health promotion have to offer us in terms of addressing stress or reducing stress. So a little roadmap of where we're going now is to look at this old system of medicine called Ayurveda, looking at food and some of the other things that it offers us to reduce our stress load. We'll look at yoga, and not the vast range of practices in yoga, but just one aspect. We'll just look at breath. And we'll touch on laughter yoga and the importance of a good deep belly laugh. And then we'll talk about nature immersion. So I have chosen to do a bit of a skim through these 4 practices so that you get a sense of the scale of opportunities that exist with integrative health. And so we'll just begin talking about Ayurveda. So Ayurveda, the word is broken into 2. Ayur means life, and Veda means knowledge. So Ayurveda is essentially a system of medicine which teaches us about life. It's much broader than just looking at illness or clinical issues. It's considered the mother of holistic healthcare. It's a very old system of medicine, somewhere between 3,000 and 5,000 years old. About 70% of Indians living in India use it. It's had a modern day resurgence. I'm sure many of you have heard of Dr. Deepak Chopra, a US physician who's really helped to bring it back to the modern day. It's considered a cousin practice to yoga, and it's very much based on health promotion, just as much as it is on disease prevention, treatment, and other aspects of medicine. It's influenced several other systems of medicine, and it has two basic texts, the medical text and a surgical text, Charaka Samahita and the Sushruta Samahita. And it's got two really germane aims to our topic today related to stress. It's to preserve the health of those who are already healthy and to help them to attain the 4 principles of life, which are essentially to be able to move through your life in healthy fashion, and then to treat illness and disease. So what does health mean in an Ayurvedic context? It means uninterrupted physical, mental, spiritual happiness and fulfillment, a true balance of the organs and systems of the psyche and spirit. It also goes beyond the superorganism or the mind-body and talks about balanced and creative relationships with fellow creatures and nature as a whole, our family, our friends, our work mates, the climate around us, the ideals and customs, and truth and ourselves. Very philosophical in its cosmological worldview. So these are some of the publications that I have on Ayurveda, just to let you know. I've written about this subject. I believe that these ancient systems of health knowledge have quite a lot to offer us in the modern day, and certainly in the time of COVID-19, when we're living through quite a lot of stress. So let's talk about some brass tacks now. What actually does Ayurveda have to offer us? Well, the first thing it has to offer us is the importance of sleep. And this is a really evidence-informed recommendation that Ayurveda has. There's been lots and lots and lots of research done on the importance of sleep. And it's one of the easiest and the cheapest things that any of us can do to take care of our health. We really don't need to pay a physician or pay anybody to help us get more sleep. It certainly is easier said than done. There's no doubt about that. But having good sleep hygiene from about 7 to 9 hours is what's recommended. Some people do need more than 9 hours, but certainly trying to get a good night's sleep is a huge part of what Ayurveda recommends. And then resting during the day as well. I have a paper in my back pocket that I'm ready to write at some point, looking at napping and the public health benefits of napping, because there's a huge amount of evidence showing that we are a chronically sleep-deprived society, and that lack of sleep and lack of rest causes a huge number of pandemics, one of our big pandemics being motor vehicle accidents, and one that we simply take at a kind of an acceptance. We have a cultural acceptance that many Canadians die in motor vehicle accidents. But certainly if we slept more and napped during the day, a good 15 to 20 minute nap during the day, usually between 1 p.m. and 5 p.m., is a really good idea according to Ayurveda, and certainly has lots of good literature to back that up. So besides sleeping and resting, Ayurvedic recommendations for these COVID times to reduce our stress involves something that in Ayurveda are called dinacharya, which is a basic daily routine. So the daily routine in Ayurveda is, it looks something like this. You have a good night's sleep, you wake up in the morning, and you wake up with positive thoughts. And my friends, this is something that I really do try to do. I wake up in the morning and I literally put a smile on my face. Even when my eyes are still closed, I'm just lying in bed, I put a little smile on my face and I think of something really positive. And that is an Ayurvedic recommendation. And then, of course, you go to the washroom, you do your ablutions, and then the first thing that you put into your body is water, and it's usually room temperature water. And then doing some exercise, doing some yoga, and of course, yoga we'll talk about later, asana, pranayama, and dhyana. So that's the physical poses, the breath work, and a little bit of meditation. And you do all of these things before you eat anything. And then when you do eat, in Ayurveda, there's some pretty good recommendations. And what I really appreciate about Ayurveda is that even though it's prescriptive, and you'll see I've got some 6 suggestions here that come from Ayurveda, there's a lot of forgiveness in Ayurveda as well. And so if you don't do all of these things that I'm about to read off, you can have some digestive herbs like fennel or cardamom. There's lots of forgiveness if you don't do what is recommended for food. But it's a long lecture. I give a whole 3-hour workshop just on Ayurveda and nutrition. And I'm really giving you a sort of a smaller version here. So according to Ayurveda, food needs to be eaten in the proper amounts, not too much and not too little. So sort of like 2 handfuls of food so that your stomach, if you can imagine your stomach, it's got 1/3 food in it, 1/3 water, and 1/3 air. And trying only to eat on an empty stomach. So not just because the rest of your family is eating because it's time to eat dinner, but just trying to eat only when you're really ready to eat and your stomach does feel empty. And it does necessitate a kind of connection with the body so that you feel like you're really able to listen inside and listen to the cues that your body gives you. Ayurveda also recommends that food should be eaten in a pleasant surrounding with the proper equipment so that you can eat well. So at any point, if you're able to look at some greenery, if you're able to surround yourself with people you love, having all the right things that will make your meal pleasant and peaceful, that's certainly important. Trying not to rush through your food and not to slow it down too much either. Many of my colleagues at UBC are really definitely guilty of number 4. We eat really fast a lot of the times. I can say that for me and my colleagues. Me included, gotta get the reminder to not eat in a rushed manner. And one way to do that, and this is a real toughie, but I encourage all of you to try this. Chew your food several times. And if you want to really, really go for the Ayurvedic recommendation, try 32 times. Mahatma Gandhi said that we should swallow our solids like they're liquids, and also swirl around our liquids in our mouth. He was a big fan of Ayurveda. If you are fans of Mahatma Gandhi, you'll note that he really liked Ayurvedic medicine. And then another really evidence-informed recommendation that Ayurveda makes is to try to be calm and relaxed while you're eating. Certainly eating when you're angry or upset is never a good idea. We never want our nervous system to be out of its calm and stable state while we're eating. So in this romp through these topics, we're now going to move on and talk about yoga. So yoga is a practice that, if any of you who are on this call come from Vancouver, know that it's offered everywhere. It's very, very popular. It is mainly practiced in the places outside of India as a body practice. So mainly the exercise component or the asana component. But really, it comes from a very philosophical root, a very spiritual place. Yuj is the Sanskrit verb that is at the basis of yoga, which means to join. So that means to join the mind and the body, to join who we are with all forms of life. It's a very deep, deep philosophy that underpins yoga. There's considered no separation between mental and physical health. And this, like Ayurveda, comes from India. It's a practice that was created by the rishis, the wise people. The famous one's name is Patanjali. He wrote the Yoga Sutra. And it can be a purely physical practice as well. So this is the tree of yoga. It shows you that the third one, asana, is the one that I mentioned, which is really the one that's mainly practiced in this part of the world. But it starts with yama and niyama, which are more like philosophical principles, and it goes to pranayama, which is life force vitalization practices, and it moves on until you get to samadhi, which is a place of true bliss and feeling very calm and very connected to source and connected to all things that are alive. So during COVID-19, my friends, I would really recommend that the one part of yoga that you might want to take up is the breath. And particularly at any point, if there's any stress in your life, which I think is about 100% of us, almost 100% of us right now, the deep exhaling through the mouth is a really, really great idea. And I'm just going to demonstrate, and I invite you to do these with me. I'm going to show you just a couple of these. So the deep exhaling through the mouth, we usually do that with a sound. So just making any kind of a vowel sound, something like this. And you let the jaw open and almost allow a kind of a yawn to come in. So that yawning opening of the mouth is really helpful in helping the whole body to relax. So I'll do one more of those. Just trying those as we do this together. You can turn off your video if you don't want anybody to see you. And then the next one is the flutter breath, and it sounds really funny, but any musicians amongst us will be very familiar with this. Also very, very relaxing for the whole jaw area, but it sounds and looks like this. Those of you who do a lot of talking for a living like I do, I really recommend this because it gets all of this whole area kind of soft and relaxed. So we'll try it again. Any trumpet players out there are going to be real expert in knowing how to do this. Again, it's like this. Inhale. Really let your breath out. The last one I'm going to show you is Sinasana, a yoga breath, which is really, really good for exercising the muscles of the throat, which are actually really hard to access. And so in yoga, they do it through the tongue, and it looks absolutely ridiculous. And so if there's any opportunity for you to have a good laugh, I hope you laugh doing this. So it's the lion's breath, and it involves the hands and the rest of the body, but I'm just going to show you the facial part. So it goes like this. Inhale, and then you go like this. And you kind of do a lion's roar by sticking out your tongue. But when you stick your tongue out, it really gives the opportunity for the muscles in the throat to get a little bit of an exercise. The last thing that would be really, really helpful from yoga in terms of COVID-19 and stress is the last part of most yoga classes, which is called Shavasana, which is the deep relaxation. And it's a 5 to 25 minutes just lying on the floor or lying on your mat or lying on your bed and relaxing each part of your body progressively while you do the deep breathing, just that slow, deep belly breath. I really, really hope that some of these practices do help you through this time, and that all of these things, which again meet the triple aim, are accessible to you. So these are some of the research and writing work that I have done in the area of yoga. I'm doing a study right now in India looking at yoga and Ayurveda for the improvement of maternal and child health. So I continue to be an active researcher in this field. I am also a yoga teacher. I've taught yoga in over 50 countries. So that is the yoga piece. We're going to do a very, very short discussion of laughter yoga. And just to let you know, again, laughter meets the triple aim. It's fun. It's an excellent form of stress relief. It's quite well researched now. If you are a medical researcher and you just look up laughter, and physiology, you'll find a lot on the physiology of laughter and how good it is for the mind, body in general. I also do teach laughter yoga, and we typically do laughter yoga without jokes. But I just wanted to just remind you that laughter is something that we can all really access, and it's super easy to access. Here's just a joke that's kind of related to the topic at hand. I have an earache, and in 2000 BC, somebody would say to you, "Here, take this root." But in 1000 BC, they would say, "That root is heathen. Here, say this prayer." In 1850 AD, "That prayer is superstition. Here, drink this potion." 1940, "That potion is snake oil. Here, swallow this pill." 1985, "That pill is ineffective. Here, take this antibiotic." 2000 AD, "That antibiotic is artificial. Here, take this root." So you see how we've kind of come around in this kind of spiral-like fashion in many ways to come back to these forms of integrative health and look again at things that are natural and that don't hurt us. This is a really silly little joke that I find really funny. I'm going to just quickly go over it. It's a letter from a department store to a woman whose husband has gone in the department store and caused some havoc. And it says, "Dear Madam, over the past 6 months, your husband has caused quite a commotion in our store. We cannot tolerate this type of behavior. As a result, we'll ban your entire family from shopping in any of our stores if even one more incident occurs. We have documented all incidents on our video surveillance equipment. Our complaints against your husband have been compiled and are listed below." November 23rd, "He set all the alarm clocks in housewares to go off at 5-minute intervals. January 10th, he went to the service desk and asked to reserve a bag of potato chips. January 23rd, moved a caution wet floor sign to a carpeted area. February 15th, set up a tent in the camping department and told other shoppers he'd invite them in if they'd bring pillows from the bedding department. March 26th, looked right into the security camera, used it as a mirror and picked his nose. And hid in a clothing rack, and when people browsed through, yelled, 'Pick me, pick me.' And on May 16th, went into a fitting room, shut the door, and waited a while, and then yelled very loudly, 'Hey, somebody, I need some toilet paper in here.' Sincerely, the store complaint department." So maybe you didn't find that funny, and maybe you did. But if you did find it funny, I recommend you find some jokes and a way to keep yourself laughing. The last thing that I'm going to touch upon, and I know that we're kind of running through our time really quickly, is salim-yoku or shinrin-yoku. And most of you, I think, are in Canada. And so I really wanted to raise this area because in Canada, we have an abundance of nature around us. This technique, this system of health promotion actually comes from Japan and Korea. So shinrin-yoku is a Japanese term, and salim-yoku is a Korean term for nature immersion, or very poorly translated into the English language as forest bathing. So we know that forests and other systems of other ecosystems are an important component of population health. We know they provide food and medicines, recreation, rehabilitation, relaxation, and rest. We know that from research done quite recently around the world that people report less mental distress and higher life satisfaction when living in greener areas, even, and this is the public health person in me, even after accounting for changes in income, employment, marital status, physical health, and housing type. There's an increasing evidence base looking at the importance of people being in nature. We know from the literature that it provides a sense of calm, peaceful serenity. And here in Canada, most of us have access to forests, beaches, rivers, lakes. It's very, very clear that the literature in this area says get outside and walk, run, cycle, picnic. And clearly during the COVID-19 times, staying 2 meters apart is really important. And it is actually quite easy to do that, particularly if you're going hiking or something like that. So in conclusion, I want to say that during these COVID-19 times, it's possible to practice stress reduction through some of the integrative practices that I've mentioned. We know that our health is really our happiness. So when we take care of our health, we improve our own state of well-being. Well, we didn't talk about public health and structural approaches to well-being. They certainly are a really important part of COVID-19. And so making sure that we take care of all our citizens and everybody in the ecosystem is really important. And I've given you some tips from Ayurveda and yoga, shinrin-yoku and salim-yoku. And all of these systems of health promotion remind you to be kind to yourselves. And my friends, if that's one thing that you really can do, be compassionate to yourself and be compassionate to those around you. So I'd like to say thank you, shukriya, grazie, grazie, merci beaucoup, muchas gracias.
Thank you very much, Farah. So I'm going to take over the screen and I'm going to move over to our question and answer platform, which again today is Slido. And I'll just repeat those instructions for anybody who joined us later and may have missed the instructions. But if they could please open, a browser on smartphone or on their laptop that they're using and type slido.com. And our event code today is EXL519. So Farah, I'm just heading over now to that Q&A platform, and I hope in a moment that you will see our Slido screen popping up with the questions. Can you see that? Yeah. So I'm going to highlight the questions, Farah, and I'm going to ask them, giving you a time to pause and consider and respond to the questions. So our first question from our listener today is, how do you think integrative healthcare can be better implemented into our medical system in BC?
Thank you so much for that really important question. I actually did my PhD thesis looking at that exact question. And I do believe that it can be implemented at cost savings. I believe that we can integrate the kinds of things that I talked about today. I'm a really big supporter of clinics and healthcare provision, which is integrative and which brings together allopathic physicians, nutritionists, practitioners of yoga, mental health practitioners, naturopathic physicians, traditional Chinese medical doctors, all in one setting. And we have a few of those in British Columbia today, some for cancer, some are private. I am a big fan of public systems, and so I believe that we can work with our governments to try to make these things happen. And slowly, we're seeing more and more integration in hospital systems. A lot of nurses have taken up integrative health practices. Things like Reiki and hands-on energetic kinds of touch have been taken up. And so I'm feeling like we're kind of getting there. We've got a long way to go, but we are getting there. And I do think that with the greater evidence base that we have, that we're in good shape in that regard, because I think that all the systems that we bring in should be evidence informed.
Okay, thank you, Farah. Next question. What advice do you have, Farah, for how to best determine which alternative healthcare practices are legitimate or not?
Another great question. There are many good ways to find out. So a lot of us are becoming a lot more savvy now in terms of looking at medical literature. So one really, really good way to just find out whether there's any research-based evidence on a particular practice or healthcare or herb or product is just look it up. It's the one system that's really free and easy to use is PubMed. Anybody can use that. So just going into PubMed and just seeing if there's any literature on it. Not everything does have review studies. Review studies are typically what we want. And in fact, in the field of integrative health practices, most of what the Cochrane Collaborative is saying for almost all of them is more conclusive research is required. So you might not get the answer that you want through peer-reviewed medical literature. And so then what most people do end up doing, and this is really dependent on your social circle, but is ask somebody you trust. That's what we do know, is that health-seeking behavior is traditionally done through are circles. And so mothers end up being the ones who end up giving the most advice. That's actually how most people get to any system of health, is by asking the mother or the woman in their life. So if you do have a trusted person in your life, then asking that person is usually a good way to go, because at least you'll trust that person. Mm-hmm. Thirdly, you can also look up the regulatory bodies and see if that system has a regulatory body, and if they're, if there's a good way that there's sort of a college of practitioners of that particular practice, and then that way you'll get some idea that at least there's a protective body there for protecting the public. That's what regulatory colleges are for protecting the public.
Mm-hmm. Great, thank you for that advice. So recommendations and checking out regulatory affairs. Next question. Given sleep is so important to our health, and many of our seniors do not have interrupted sleep during the night. Many of our seniors do not have interrupted sleep during the night. Have you any advice to ameliorate this? Maybe it's many of our seniors do have interrupted sleep during the night.
Yes, I think that it's hard to get a good night's sleep for a lot of seniors. So, the most important thing is just to be really non-judgmental on yourself if you're having a hard time sleeping more than 3 or 4 hours at a time, and just waking up and maybe reading or doing a little bit of a walking around or some deep breathing, anything that can keep you very, very calm. Certainly we know that getting onto a screen, like onto your phone or onto the computer, is probably not the best thing to do if you're having a hard time sleeping. But anything that just helps you do breathing, like if you can, for example, lie down, put your hands on your belly and count your breaths. We used to count sheep. Now we are recommending counting your number of breaths. And if you can get up to 100, you're probably really awake. But if you normally wouldn't be able to get up to 100, and because the slow, deep breaths just really relaxes the mind body, and then you often should be able to just fall asleep doing that. But again, don't be too harsh on yourself if you have a hard time, because a lot of people have to get up in the middle of the night to go to the washroom, and then it is hard to fall back asleep. So, your calming music, all of those kinds of things should be able to help you at that point.
And FARAH, if they reach 100 and they can't go back to sleep, would you recommend that the person gets up out of bed and
just a little
engage in something?
Maybe some reading. If you do practice yoga, some very, very gentle asanas, some of the pranayama exercises you can do if you know an Adi Shodhana, very nice calming, things like that. Anything that is going to really calm you down. If you've got worries, there's also an opportunity maybe to get your journal and start journaling them out, or drawing out your worries. It's always really nice to let out what's in the mind out. So yes, anything like that. I found that very helpful myself. Sometimes if I can't get to sleep, I just do a random drawing, and it's very therapeutic. Just letting those things out of the mind. Yeah.
It's a great question, and so many people experience poor sleep hygiene. So I'm sure it's popular with our participants today. FARAH, what types of support or recommendations are there for people with mobility issues who can't go outside or properly integrate some of these type of practices?
Oh, yes. Well, certainly people who are at risk or have mobility issues and can't get outside right now are called to make the indoor of their homes their place where they do absolutely everything. So you can do essentially everything but the shinrin-yoku that I mentioned today, those of you who are indoors. You can open your windows, try to get some fresh air. That's definitely really helpful. And if you can, through your window, look at something green. That's the closest you'll get to the shinrin-yoku. And there's lots and lots of evidence that just looking at something green really makes a difference. We've done studies in hospitals to show that patients who are able to look outside at green grass, or even if they can't look at green grass, we brought in fish tanks so that patients can look at a fish that's swimming around. Anything related to nature is really, really helpful. But certainly the yoga, the Ayurveda, all of the food techniques, the resting, the dinacharya that I mentioned earlier, all of those practices, trying to start your morning with the positive thoughts, like, the smile on your face, all of those things you certainly can do from the comfort of your own home during the COVID-19 times.
Thank you. And this person is looking for some recommendations on for any Ayurveda or yoga practices online.
Yes. Well,
do you have any?
The internet is mushrooming with yoga for sure, particularly as a lot of yoga teachers, can't teach right now. So there's lots and lots of yoga online. It is, unfortunately, then, as a result of that, the blossoming of all of these offerings means that you might be getting some practices which might not be safe. Excuse me. So I would recommend looking at the Mayo Clinic to see if they have any yoga practices. I typically find that the Mayo Clinic is a really, really good site that typically has people checking it very carefully. And then Yoga Journal is another one that I have sent people to as well. They have a lot of good practices online, a lot of recommendations for asana online. There's also quite a lot of peer-reviewed medical literature in these two areas. So depending, say, like you wanting to do yoga or Ayurveda for asthma or something like that, you can again look up PubMed and see what are the particular pranayams or asanas that you can do for asthma, and you'll come up with a lot. There's lots in that particular area, or in many. There are hundreds and hundreds and hundreds of articles on yoga, way less on Ayurveda. Ayurveda is still at its renaissance in terms of bringing back research. We're getting there with Ayurveda, but it's still in the baby stages. Yoga is way more advanced in terms of the research base.
Yeah, and some of the other participants today are offering some information on our platform. So one listener is telling us sci.bc is offering great online assistive yoga classes. So that's sci.bc. And then another individual is confirming yogadownload.com has thousands of video. Go to the Groupon and get your subscription for $29 a year. So fantastic advice there.
I didn't know about these. Thank you.
Yeah, yogadownload.com. Thousands of video. Go get your Groupon for $29. That's super. Thank you. Next question. Farah, what suggestion would you have for patients whose doctors are not open to any alternative practices, are not getting the help they need? So how to have that conversation with your doctor?
So,
great question.
The literature in this area is quite clear. The majority of patients still do not disclose to their MDs. That's a big area which those of us like myself who are educators in medical schools are trying to change, because certainly we know that your health is in better hands if all your practitioners know what kinds of therapies you're undertaking. And so patients are really smart, and they know when to tell their doctors things and when not to tell their doctors things. So I think that the literature shows us that a lot of the times patients aren't telling their MDs what they're doing outside of allopathic medicine because they're worried that their MD is going to tell them not to do it. And so I think it is really important to tell your MD if you are using a different system of medicine. And I think it's one of those difficult conversations that needs to be addressed with as much tenderness and diplomacy as possible. And it's good to know what your particular MD says about holistic systems of medicine too. In BC, many, if not most, family physicians are really, really open-minded about it. And so I would recommend just ask your doctor, please let me know what your thoughts are on, juice fasting or something that you might be wanting to do, and just see what your physician says. And that begs the question that many of us don't even have a family physician. So there, this is of course a huge area, but clearly more dialogue is better. And if you are somebody who is really convinced that using holistic systems of healthcare is really, really important to you, then please do raise it with your MD. It's in your best interest, and it is very, very important that everybody knows what you're putting into your body.
Great, thank you. Where does mindfulness practices fall into this integrative health approach?
I'm so glad you raised that. I realized that I hadn't put the word mindfulness anywhere in my slides today. Mindfulness came about when John Kabat-Zinn basically translated Zen Buddhism for people who live in North America, Western Europe, and the rest of the world. So it falls very much within the category of things that I was talking about today. I tend to be the kind of person who goes directly to source. So I don't typically try necessarily to westernize practices. I want people to know that yoga comes from India, comes from the rishis. It's a practice from South Asia. I don't change names. That's not my style of research. So yes, but mindfulness is absolutely very, very much part of all of this. Breath and yoga and meditation are all part of mindful practices.
Mm-hmm. Great, thank you. And I'm getting mindful of time. It's getting closer to, it's 1:56 and we've got 12 questions. So if people want to take a look at all the questions and vote for their question to make sure that it gets answered, the questions they want to see. So the next question, is Ayurveda and these other natural treatments covered under BC healthcare system?
No, Ayurveda is not covered. And in fact, that's a huge issue when it comes to integrative health treatments. They are private in Canada mainly. Traditional Chinese medicine and naturopathic medicine and some other systems are covered, again, privately through workplace health insurance schemes. So if you're lucky enough to have one of those, if you are a UBC employee or something like that, then you're covered. It's a limited amount and it varies from plan to plan. But in Canada today, most of these systems are private. And so when you go to an alternative medical practitioner, you're paying once through your taxes and you're paying twice for the system of medicine, which as somebody who is a public health professional, I would really like to see that changed. I would like full access to everybody.
Mm-hmm, mm-hmm. Okay, thank you. What strategies have contributed in other countries for the inclusion of holistic practices, and what are the best practices that could be applied in Canada? Because you talked about the other countries that were embracing it so much more than North America. What did they do differently, Farah?
Well, they follow their old traditions better than we do. So the oldest traditions of integrative health practices in North America are those which the Indigenous nations of Canada and the United States have brought in. And thankfully, we're starting to do a pretty good job of that now. Like the First Nations Health Authority is funding groups like Sotin Lalem, which is a very, very rooted, beautiful practice, ancestral practices rooted in Indigenous health practices. So we're seeing that happening. But other countries, mainly in Europe and in Asia, just respected their older traditions and kept those going, so that there's a kind of a pluralistic medical marketplace, if you will, in most other countries. And so I think that we're getting better at that in Canada, and yes, that we do have some things to learn. If we just look at midwifery, which is sort of on the edges of whether I would consider it integrative practice or not. I have a book called The New Midwifery, Reflections on Renaissance and Regulation, and it's a Canadian book looking at midwives. But if we were to look at midwives as practitioners that look at the mind and body and help babies to be born into the world, we actually have done that very well in Canada. We've done that beautifully in Canada. But we haven't yet done it with, say, traditional Chinese medicine, Ayurveda, yoga, meditation, all of these things. So what we need in order for these things to happen is we need an upswell of Canadians asking for it. And then we need regulators and decision makers to get on board and make it happen through legislation and policy.
That's a huge.
It's huge.
Honestly, why don't we have this sort of, why don't we have Ayurveda popular in North America? Why is it not popular? It seems more useful than harm, and with much lesser harm to the body. It should be promoted.
I'm with you. I'm absolutely with you on that one. I think Ayurveda has a lot to offer, particularly when it comes to food and looking at health promotion and the kinds of things that we can do that are essentially free to take care of our health. And so that's why I am one of the people who are trying to bring Ayurveda to North America. And the reason that it's not so popular, I think, it's again, the research on it has been frozen for the past 500 years. And it's just, it's just not very well known yet, but it's getting there. And you know how I think it's going to come is through yoga, because yoga is something like, I've been teaching yoga for a very, very long time. And I used to teach decades ago, say on the beach in the summertime, and people would walk by and say, "Hey, what are you doing? I want to try that," and they join and go, "Wow, I've never heard of this." And now there's almost nobody who would say, "What's yoga?" So I think Ayurveda is going to jump on the bandwagon of yoga, and because they really come from the exact same paradigm, their cosmological worldview is exactly the same. I do a whole talk on Panchamahabhutas and yoga and Ayurveda and how they're linked. In fact, Ayurvedic physicians will recommend yoga. They really are intricately intertwined practices. So I think it'll come more. There are people offering things. I'm actually one of the forces in Canada who's helping to bring Ayurveda more to Canada. So yeah, just talking with some colleagues in Quebec right now about that.
Do you have a web page, Farah, that speaks more to this, that you can direct people to more resources that we could mention at the end? Or
you can ask people, Ayurveda. They're really
think about that while we move on. Yeah. I thought you might have a website that we can refer people to for more information. No problem. Do you think some practitioners in our healthcare are maybe not as open-minded enough to integrate some of these other practices?
Yes. Short answer.
As simple as that. Yeah. What mindfulness practices would you recommend that are more from the source and not so westernized?
The kinds of things that I mentioned today, I would recommend the breathing practices, the pranayama practices. So there are many pranayama practices in yoga that aren't taught here. I mentioned one of them, the Nadi Shodhana practice. It's very calming. There's quite a bit of evidence based to it. There's also Ujjayi, which sounds kind of like this. It's often called the snoring breath. I would really recommend that for calming. And then I was going to, but I really didn't want to talk about too many things all at once, talk about meditation. And I personally am a meditator. I meditate in a tradition called the Vipassana tradition. I would really, really recommend doing meditation in its purer form, which is usually silent meditation, and really, really learning how to calm and purify the thoughts through meditation. It's very hard. It's one of the hardest things that all my friends and colleagues who meditate have said is probably the hardest thing they've ever learned how to do, because when we meditate, a lot of things that we have pushed down in the mind come up. But in that regard, it's a beautiful way for us to really get to know what's inside us, and really, really work with the mind. So yes, if I had to give one answer to that, I would give meditation.
Okay. Are you aware of any alternative medicine practices that have been particularly effective for COVID-19 in Asia?
Well, I did look at the academic literature before this presentation, and some Ayurvedic practitioners are coming out and saying, yes, we could do a lot of preventive things, like the kinds of things that I mentioned to you, a lot of dinacharya practices and good food, and just it's basically all about just keep taking good care of the immune system and doing good relaxation and stress reduction practices. I don't think there's been any sort of particularly effective for treatment? Nothing. But particularly effective for disease prevention and health promotion? Yes, the kinds of things that I mentioned today.
Okay. Farah, how do we minimize the burden on the individual to integrate these practices into their lives, especially in today's capitalist overhaul of self-care?
Yeah, that trillion-dollar industry of self-care, it's huge, and definitely there is a lot of profit to be made off of these practices, which is why I like to do research on things that people can do on their own that are free or practically free, and that really everybody and anybody can do. And so the burden on the individual is really your choice of what kind of dinacharya, as we say in Ayurveda, what kind of daily health promoting practices you'll actually do. So it's all about knowing yourself. What do you like to do? So when I teach self-care to people, I teach gratitude, the game changer. I teach breath. I teach the eye exercises. I teach like a huge variety of things. And I say to people, you might not like any of these, but hopefully you'll like some of them. And the most important thing is that you'll actually do some of these things. So the most important thing in the individual's decision making is what you actually practice, not what you like to talk about or what you think is a good idea, because there's a huge gap typically between what we know about health promotion and what we'll physically actually do each day. And so the answer to that is really lodged in your own self-knowledge and in your own personal practice. Do you like waking up early in the morning and meditating, or going for a walk in the forest? Or would you prefer to go and be with a group of people and do Tai Chi or Qigong or Shinrin-yoku? Those are the kinds of questions which each of us have to ask ourselves. And most of us like a little bit of individual practice and group practice. We're social beings, so we typically do like to do health promoting practices together. Singing, for example, singing in a choir, really, really good for your health. Certainly something we won't be doing for a very, very long time during COVID-19. I can tell you that, unfortunately.
Yeah, that's so sad.
Yeah.
Why is alternative healthcare so expensive and difficult to access here?
Because we have a system of Medicare which essentially has made allopathic medicine the system of medicine that we all pay for through our taxes. And so every other system of medicine is de facto private. And so it's only accessible if you're willing to pay for it, have the money to pay for it, or have a workplace health insurance program that will help you pay for it. Mm-hmm. And again, that's the kind of thing like that I am working to change. You know, I started that with my PhD thesis, trying to talk about how to integrate these things into Medicare.
Okay, it's 207. Your principle number 5 is often ignored. There are people that view HC rationally, but many that uncritically accept almost anything alternative. Mm-hmm. How do you distinguish?
Yeah.
Can you remind us what the principle number 5 is?
Yeah, it was basically not accepting things uncritically that are holistic.
Right.
So not just, you know, jumping on board just because it, you know, it comes from a plant or something like that. It's so important that we recognize that harm can be done from almost any system of medicine, and we really don't want to uncritically accept anything. I personally, you know, because I'm a scholar, I always look to the literature. So I don't, in my own personal practice, do anything that isn't evidence informed to some extent. So yes, there's actually a growing and blossoming amount of literature in this area. So I hope that people would use it.
Okay, thank you. And we'll just change it up a little bit with this lovely thank you from Dagmar. Thank you, Farah. It's good to focus on helpful strategies and kindness, and revisiting some of the points is also very beneficial. So just some feedback from Dagmar. And the next question, what modalities are being used percentage-wise locally and globally? And in brackets, naturopathy, homeopathy, herbalism, Ayurveda. Percentage.
So Ayurveda in India is about 70% of the population uses it. In the African continent, various systems of traditional medicine are used around 80%. Those are in the rural areas as well as in some urban centers. Massage therapy, I can tell you in Canada, we used to have our number one alternative to allopathic medicine used to be, for decades and decades and decades, it used to be chiropractic. And now, over the past few years, Canada's number one is massage therapy. So the integrative modality that's being sought after most in Canada is massage therapy, and chiropractic is now number two. And naturopathic medicine is becoming a lot more popular in Canada, particularly as the crisis in family medicine and primary care exists, because people really need a family physician. And so a lot of people are going to naturopathic physicians as well as to doctors of traditional Chinese medicine. So those two are growing partially to fill the gaps in allopathic family medicine.
Okay, thank you. This is a little bit different. This refers to one of your slides where you had the different decades or centuries, and it says the 85 treatment is different. There's a body of evidence showing its safety and effect, not perfectly. And the 00 treatment is likely a placebo, still valuable. Any comments on that, Farah? That makes sense?
I'm so sorry. I'm not sure what this is referring to about the joke.
Well, no.
The
your slide.
Oh, yes,
Yeah.
The 1985. Yes. That some treatment is still, yes.
We can come back to that.
Yeah,
if
I'm so sorry.
you need a little time on that. Yeah, that's fine.
To figure that one out. Yeah.
Yeah. What opportunities does the current climate offer to integrate holistic care practices and shift social norms regarding wellness?
Well, as a researcher in this area for decades, I feel like we are in the moment in history which is the most open to the integration of holistic healthcare. I feel like the surveys that we've done throughout Canada, North America, and the world are showing that there are a number of reasons that people everywhere are interested in integration. From the global south, part of the reason that people, say from the African continent, the Latin American continent, Asian continent, and the Middle East are interested in doing that is because they're moving through this phase of decolonization, and they are trying to reaffirm systems of indigenous knowledge and indigenous health knowledge, and trying to reaffirm the knowledge of their own ancestors. So that's part of the movement towards integrative health around the world. And as I mentioned earlier, it's the same thing for indigenous systems of medicine here on Turtle Island, where a lot of indigenous healers who had to hide because they would be killed over the past few hundred years are now not needing to hide. And so the current climate is offering a wonderful catalytic opportunity to bring these things which were hiding for their survival out into the norm. I feel really, really, really hopeful that we're getting to a good place today.
Okay, great. And the final question for today. Where can we find recommendations for naturopaths and alternative practitioners?
I'm going to have to basically make the same answer as I did for the last question. There's no really easy way to find out who's a good naturopath for you or a good traditional Chinese medical doctor for you. Most people do word of mouth.
Right.
You can try to do these sites, which I'm not a huge fan of necessarily, these rate my doctor sites, sometimes they tend to attract the negative comments. So I wouldn't recommend those typically. But there isn't an easy way to find, say, a naturopath or a doctor of traditional Chinese medicine that, you know, is sort of highly respected or well trained, or there really isn't, unfortunately, one that I know of. So please do reach out to your own circle and do that. And maybe social media is a way to help you do that. But, you know, it has to be based on someone you trust.
Yeah. Yes, that network. Okay, thank you. So that was said. I'm just mindful of time. There are a couple of questions that we didn't get to today, Farah. So I'm just going to move away from our questions and move into our last slide, which is, of course, my thank you. Thank you, Farah, so much for sharing that information today and being so generous with your time. I hope it was very helpful to our listeners, judging by the questions, I believe it was. And also thank you to our listeners, our participants today, for their great questions. The session is being recorded. It is available on our YouTube channel. So if there's any information that Farah said that you may have missed, it will be on the recording, and it will be on our YouTube channel very, very soon. Any questions, don't hesitate to contact us at info.exl@ubc.ca, or our phone number 604-822-1444. Thank you very much, everybody. Stay safe. See you soon.
Bye.
Bye-bye.